Our focus on the hospice story continues today. November is dedicated to raising awareness and getting information out about hospice programs. There are a number of programs right here in Central Ohio, all very different, all dedicated to caring for patients and their families along the final journey of life. Joining me today is Dr. Jennifer Hirsh, the medical director for the Wexner Heritage Village and Zusman Community Hospice. Dawn Havens out there on the end, a registered nurse at Zusman Hospice, and Helen Tatman, whose husband is receiving care at Zusman. Welcome to all of you, first of all. We really are happy to see all of you here. Dr. Hirsh, let's start with you as the medical director. Just tell us a little bit about your facility, if you would.
Well, Zusman is a unique hospice. We are a small hospice here in town. We have both an inpatient unit with 5 beds, but most of our patients live in the community. They live in their private homes or nursing facilities, and we just have a wonderful staff of nurses, social workers, chaplains, and volunteers who reach out and take care of families like Helen's.
Let's talk about the initial decision to put a loved one into a hospice care situation and when you understand that that person is eligible and ready for those benefits.
Okay. Well, hospice is appropriate for someone when we're approaching the end of our life, which is a difficult kind of thing to qualify. For most of our lives, we think about the years ahead of us, but there comes a time for each of us when we start thinking about our time left in terms of months. An individual may have a terminal illness like heart disease or cancer or dementia, or they may have a combination of medical problems. And those things together are making us think of our life in terms, again, of months that we have remaining. It's a conversation that happens between a loved one and their family and their doctors, and we say, you know, we're changing the focus of our care now. Instead of looking at trying to prolong our life indefinitely, which is usually our goal, we want to focus on comfort. We want to say this is the quality. We want the best possible quality for the time that we have. We don't want to go to the hospital anymore. We don't want aggressive interventional treatments that have great burden. We really want to focus on the things that just bring us comfort and bring support for our family.
Sure. Helen, your husband Howard is in this program, and I know he's watching this program today, so you can say hi to him if you'd like.
Hi, Howard.
There you go. What made you choose this program?
For one thing, I have 3 children, but they all live out of state. And I have no relatives here in Columbus, so it's just Howard and I. And when I was approached to have hospice, I was so grateful. And I get more grateful every day because I now have 11 people from hospice that I could contact. And they are like Jennifer here, Jennifer Hirsh, and there's a nurse like Dawn here that come to my house to take care of Howard's wound. He has lung cancer now. And I also have babysitters that come. One of them is Mark, who is staying with my husband while I am out here enjoying myself. And I have 2 social workers that come. I have a massage therapist that comes out to help Howard with his problems, you know, it kind of relaxes him.
Sure, really every need is taken care of. That's awesome. Dawn, you as a nurse, you deal with these families a lot, and just talk a little bit about what you do to take care of the families and their needs. Helen has already shared a lot of those stories with us.
Yeah, we have a lot of support systems. We have a lot of volunteers that are grateful to go and spend time with these patients and their families and become very close to them. We provide nursing visits depending on the condition of the patient. Can be once a week or every day if needed. So we're always at their call whenever they need us.
And people of all faiths are eligible for this program, correct?
Absolutely, absolutely.
And Dr. Hirsh, it's a small program, so you see that as a big benefit.
I do, absolutely. It allows me to actually do house calls to every single one of our patients, which is a really phenomenal thing. And that, as Dawn said, is sort of based on medical needs. Our nurses are available to patients 24 hours a day. Actually, all of our team members are. The nurses are sort of the first go-to, but this is one of the special things about hospice, I think. And it's one of the very scary things when you decide you want to leave the hospital is what happens when a crisis hits in the middle of the night. And through all of our lives, we call 911. But now we know we don't want to go back to the hospital. We don't want flashing lights and we don't want more drama. And so now you have hospice who's able to come in and support you and provide medical comfort, provide emotional and spiritual support, and whatever needs that you and your family express to us.
And individual needs are so important too. Ladies, thank you very much for being with us. And Helen, say hi to Howard for me, will you?
Hi, Howard. I'll be home soon.
There you go. That's awesome.
All right.
Thank you very much, ladies.